Our next guest is one of the biggest medical influencers on social media.
Blood pressure meds, they're better than ever before. They pale in comparison to the change I can make in a patient's blood pressure with diet and exercise. The levels aren't even close. Medications that are starting to show promise, like the Ozempics, the GLP-1 agonists, the Mounjaros, they are better, but then access becomes a disaster.
And that last point is really relevant as weight loss drugs appear to help with a whole slew of conditions and diseases beyond just dropping the pounds. What about the side effects? Here to break it all down for us is primary care physician Dr. Mike. Hey, Dr. Mike, 25 million followers. Congratulations.
Thank you so much. Excited to talk health.
Yeah, let's talk about Ozempic. Should everyone be on it? And have they done enough research to make sure it's safe long term?
Yeah, well, we have to be honest and understand that Ozempic is a prescription medication. When we have a prescription medication, this is not a supplement. This is something that is used for a specific indication. And that indication comes from good quality research that not only tells us it works for that condition, what patient population it works for, what are the risks and side effects of taking it, as well as drug-drug interactions. We need to have all that data if we're going to make that recommendation to our patients. When it comes to the supplement industry, they'll say it's for everyone. Everyone should take it. There are no side effects. There are no interactions. And we know that not to be true. So when we use a medication like Ozempic, Mounjaro, tirzepatide, any one of these, we have to be really careful that we're using it appropriately, not overusing it, and counseling our patients on the risks.
Okay, I know all of your followers, they have lots of questions for you. So we have three that people sent in. They want you to answer. Is eating organic healthier?
This is one of the biggest myths in the world.
Really?
The American standard diet is terrible, not because people are not eating organic. It's because we're not eating fruits and vegetables. So whether organic or not, please eat your fruits or vegetables, both actually. And in reality, organic produce still have pesticides on them. Some people believe that organic means no pesticides. That's actually not true. So please eat any kinds of fruits and vegetables that you have available.
Okay, now, what's the best fruit? Is it blueberries? That's what I'm hearing.
I love berries because they have a low sugar content and a high fiber content, so I like them for that. But don't judge food as the best versus the worst. Try and find a healthier balance as what does my body need, what do I enjoy eating, and what is that balance I can strike?
Okay, how valuable are wearables like the sleep trackers and fitness trackers?
People are obsessed with those. I have patients coming in with all sorts of flags that these trackers have sent them, whether it's 5 seconds of atrial fibrillation or something else. But the reality is these trackers can create health-related anxiety. We actually have a condition called orthosomnia, where people are harming their sleep because they're tracking it too much. And in reality, Ainsley, if you have a bad night's sleep, do you need a watch or tracker to tell you had a bad night's sleep?
Right. Yeah. I don't wear it because it's not going to change anything. I either had the good sleep or the bad sleep.
Exactly.
And I don't want that anxiety.
Exactly.
Okay, is sunblock actually bad for you?
Absolutely not. This is something that's been extrapolated from some animal research when it comes to chemical filter sunscreens, because there are actually two types, mineral and chemical sunscreens. I prefer using mineral sunscreens. These are physical barriers. There's no side effects to using them. And in reality, the #1 cancer that we as humans will get this year is skin cancer. And it's also the most preventable. So please wear your sunblock. Don't allow people to fearmonger too.
Okay, what brand do you recommend? Because when we go to the drugstore, if Coppertone is on sale, that's what most of us are going to get.
I would get whichever one is most affordable. And a lot of people wonder what's the best SPF. I say just go for the 30, the 35. Anything higher really isn't that much better.
Yes.
So get the one that's at least 30, put it on. And in reality, sunblock is not the end-all be-all. It's shade and staying out of the sun, not just for skin cancer, but also to make our skin look better.
Right. Is there one area that you see the most melanoma or the most skin cancer?
Honestly, it's all over the body. And sometimes with melanoma, you have it in surprising places that are not even sun exposed. So you have to be really careful when doing skin checks on patients.
Okay, because I'd heard like left side of your face, because when you're driving, that's exposed.
That can happen a lot. You'll also see in truck drivers who are frequently driving with their windows open, their side of their face that's sun exposed gets more aging on it. So you actually see more wrinkles, drier skin in that area. Very interesting stuff.
That's interesting. Lawrence's dad is a truck driver, but he's never going to age.
Exactly.
Thank you so much, Dr. Mike. We appreciate it.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhardt. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.